Miss Nikki, I failed my nurse aide state exam yesterday.
I'm so sorry, Joy.
I know you warned me about not taking a refresher course because I waited a year to take the test, but I had so much going on.
Yes, you did have a lot going on, I remember. But I heard things are better now, and all is not lost. You can still pass.
Well, that's why I'm here. I really need your help with the test questions.
No problem. We can go over some questions. Do you have time now?
Yes, thank you.
Have you been studying the material I gave you?
Yes, I have, and it was very helpful. Thank you.
All right, let's see what you know. I'm going to ask you a series of questions and give you some options for answers, okay?
All right, let's do this. I'm ready.
I like your excitement. Okay, question 1. Prior to weighing a resident on a manual scale, the nurse aide must always A. Zero scale out, or B. Have the resident take off their shoes.
The correct answer is A.
Correct. Next question. When measuring intake of the following items, what would you measure in cc's or mLs? A. Soup, B. Cooked eggs, or C. Bread?
I'm gonna go with B. Eggs.
I'm sorry, Joy, that's incorrect. The intake of eggs is based on percentages, such as eating 50 to 100% of an edible meal. Let's try the next one. What type of universal precaution, now called transmission-based precautions, would widely be used for influenza? A. Direct and indirect contact, or B. Airborne and droplet?
The correct answer is B. Airborne and droplet.
An example of pronation would be A. Palm up, or B. Palm down?
Oh, that's easy. B. Palm down.
So far, so good. Now the next question. What would you report to a nurse aide immediately about your patient? A. Talk of suicide, or B. Increased appetite?
A. Talk of suicide. That would be way more important than anything.
You're so right, Joy. Even a sheet can be considered a weapon for suicide. They can stuff that sheet down their mouth until they become asphyxiated. That is why individuals with suicidal ideation need to be closely monitored. Now, what does the abbreviation HTN stand for? A. Hypertension or high blood pressure, or B. Stroke?
A. High blood pressure. That's a no-brainer.
Let's see. How about this one? What is the medical term for hyperglycemia and hypoglycemia?
I got this one. It's A. Diabetes. And I know this because my mom is a diabetic.
Awesome. Most people get that one mixed up. What is considered a clear liquid diet? A. Gelatin, B. Milk, C. Pudding, or D. Yogurt?
A. Gelatin, because you can see through it. The rest you can't see through.
Okay, let's do a few more. If your client drank 240 cc's or mLs of cranberry juice and 50 cc's of milk, then ate 20% of their oatmeal, what would their total fluid intake be? A. 310 cc's, B. 290 cc's, or C. 240 cc's or mLs?
Oh, I'm gonna go with A. 310. I got this because I can't add.
Well, although adding is very important, however, you need to know what to add. I said fluid intake, which would be 240 cc's of cranberry juice plus the 50 cc's of milk. The eggs are based on percentages, not in cc's or mLs. So the answer is B, 290 cc's.
Oh, I see. You did say liquids, and I added the food intake.
Okay, the duties of a nurse aide is all except the following. A. Vital signs. B. Range of motion. Or C. Administering medication.
I'm going to say C because that is out of our scope of care.
That's very correct. Only licensed medical personnel should be administering meds, or individuals certified by their state to administer medication. Now this one may be hard. When providing care to a patient, the nurse aide notices a reddened area on the patient's coccyx. The nurse aide should A. massage the area, or B. turn the patient on the opposite side.
The answer is B. Turn him on his side and tell the nurse, because you don't want to massage the area.
True, and if the redness doesn't go away, it's considered a stage 1 decubitus ulcer or pressure sore. Now for an easy one that everyone misses. A new admit should be oriented to A. their call light, B. their remote control to their bed, or C. remote control to their TV.
I would say A, because that's his best way of contacting us for any and all problems.
Yes, as a matter of fact, sadly I heard of a situation where a new admit did not receive care for an entire shift because her call light was not within reach. The nurse failed to inform the nurse aide of the new client, and the aide did not check all her rooms. They both were suspended. And that's why it's a good practice to check all your assigned rooms first before providing care to your patients. And get report. Okay, now for the next one. We're almost finished. What is the most effective way to stop the spread of infection? A. Wearing gloves at all times, or B. Hand washing, or C. Wearing isolation?
B. Wash your hands.
Yes, you're on your way to passing this test. Okay, let's say you have an unconscious patient that needs oral care. You should A. turn their head or body to one side to prevent choking and aspiration, or B. lay them flat on their back in the supine position to prevent choking.
I'm going to have to guess this one. I'm going to go with A. Turn head on one side, because it sounds good, but I'm only guessing, and that's why I need your help, Miss Nikki.
Well, that's a very good guess. Lying someone on their back can cause choking and aspiration, but making sure their head is lateral will reduce the risk. Okay, last one because I have to attend a meeting. What is the medical term for difficulty swallowing? A. Dysphagia, or B. Dysphagia?
I'm guessing again because I don't even know the definition of those. I'm going to take a wild guess. B.
Oh, sorry, Joy, that is not correct. Dysphagia is difficulty with speech, not swallowing. I like to teach my students to remember the difference first by exaggerating the words, then use a hint. Like dysphagia has a G in the word, therefore having to do with gut. And dysphagia has an S, which can be related to speech.
That's why this is a great tool to learn by, because I would have missed that, and that could have caused me to fail the exam.
Okay, overall you did great. When can we schedule the next session? Let's make it a full hour next time.
ASAP, because I need this help, and I need you.
Thank you, I'm flattered, but Joy, you are the one who took the initiative to go to school and learn, and you're not giving up, so you deserve the credit as well. Well, I've got to take off, I'm running late.
Bye, Miss Nikki, and I can't wait for our next tutoring session.
Ditto, kiddo.